Dive deep into issues affecting our society, trying to make sense of the numbers. All right, now and today we turn our attention to a staggering burden that continues to plague Kenya: the prevalence of cancer. Tonight we unravel the numbers behind the growing crisis, the stories of those affected, and the initiatives aiming to make a difference in Kenya. Cancer has become an ever-increasing threat, affecting countless lives and putting an immense strain on healthcare resources. Let's take a look at the numbers that reveal the extent of the burden. Now, the International Agency for Research in Cancer, Globocan, report for 2018 estimated 47,887 new cases of cancer annually, with a mortality rate of 32,987. Now, this represents a close to 45% increase in incidence compared to the previous report that estimated 17,000 new cancer cases annually, with an annual mortality rate of 38,500 in 2012. Now, breast, cervix, uteri, esophagus, prostate, and colorectum are the leading types of new cancer cases in both males and females across all ages, with esophageal cancer being the leading cause of cancer death, followed by cervical cancer and then breast cancer. Now, among men, prostate, esophageal, and colorectal are the leading cancers in incidence. In women, we have breast, cervical, and esophageal cancers, which are the most common. Now, it is further estimated that there are 3,200 new cancer cases among children below 18 years, with top 5 commonest cancers being leukemia, non-Hodgkin 7's lymphoma, kidney cancer, brain cancer, and cancer of the nasopharynx. Now, it is estimated that up to 40% of cancers can be prevented by avoiding risk factors and implementing existing evidence-based prevention strategies. Now, Kenya continues to grapple with a high burden of risk factors for cancer, as demonstrated by various country-in surveys. Now, an estimated 27.9% of Kenyans are overweight and obese, while 94% do not consume adequate fruits and vegetables. Now, tobacco use among adults is estimated at 13.3%, while alcohol use is at 10.3%. Further, with increasing urbanization and industrialization, there is increasing exposure to environmental pollution, including toxic industrial, agricultural, and electronic wastes. While there is no local data on the burden of genetic factors for cancer, inherited genetics mutation play a major role in about 5 to 10% of all cancer globally. Now, the burden of cancer continues to rise globally, with an estimated 18.1 million new cases and 9.6 million deaths in 2018. Now, about 1 in 6 deaths globally is due to cancer. Now, low and middle-income countries here bear the brunt of the cancer menace, with approximately 70% of cancer-related deaths occurring in these countries. Now, the number of new cases is expected to rise by about 70% over the next 2 decades. However, we are talking about survivors today and celebrating them. So let's take a look at this account of breast cancer survivors and other types of cancer.
After 20 years, cancer ikakuja tena, ilikuja hapo armpit. Tayari wakati huo sikutolewa, I was not done surgery. Nilipewa dawa ya chemotherapy na hiyo lump ikaisha. Saa hii niko na miaka 30, hiyo ya pili iliisha, ya kwanza iliisha, na saa hii naendelea na kujiangalia.
Tunaambiwa kwamba kila siku hapa nchini kwetu Kenya, wamama 9 wanakufa kila siku kwa sababu ya saratani ya cervix, lakini mimi nilisurvive, na kuna wengi pia, na hii siku tunasherehekea siku ya survivorship, na tuko hapa kusema kwamba kuna wale ndio walifariki, lakini sisi tumeishi. Na ningehimiza wamama pia tuweze kwenda kupimwa mapema. Nasema hivyo kwa sababu wakati mimi nilipopimwa sikuwa na dalili yoyote, na nikapatikana tayari saratani ilikuwa imefika stage 2.
Now, these stories highlight the devastating impact that cancer has on individuals, families, and communities, and also their success stories. The fight against cancer in Kenya is being addressed through a multifaceted approach. Non-profit organizations, government agencies, and healthcare institutions are working together to raise awareness, improve access to screening, and enhance treatment options. Now, there exists a number of legal and regulatory frameworks that guide the provision of health services in Kenya, particularly cancer prevention and control. Now, health service delivery in Kenya is organized into 4 tiers. Tier 1, which is community health service, where we have Tier 2 is the primary care, where we have dispensaries and health centers. And Tier 3, where we have secondary referral, where this is basically county hospitals. Tier 4 deals with tertiary level, which is the national referral hospitals. Now, primary care for cancer involves activities towards the prevention of cancer, such as risk factor reduction and screening, and health promotion activities, including public awareness, community engagement, and social mobilization. Now, these activities are carried out at all the tiers. Screening is mostly carried out at the tiers 2 and above, while cancer diagnosis and treatment is largely carried out at the secondary referral facilities and at the national referral hospitals. Now, as the burden of cancer continues to grow in Kenya, it is crucial that we come together as a society to address this issue by raising awareness and improving access to healthcare services. We can make significant progress in the fight against cancers. That's all for the we can make significance in the fight against cancer if we come together to actually deal with this issue. Now, that's all for the big number tonight. Up